Hello my dear students, this is Dr. Rohit Daniel, your orthopedics faculty from Doc Tutorials. Today we will discuss how you can examine any orthopedic case for your exam. See, for your final year exam, many a time you will get a short case in orthopedics, and most of the time your examiner is just going to ask you regarding the diagnosis, but rarely sometimes they can ask you regarding the basic concepts of examination. So before you go and attend that exam, make sure that you have a rough idea of what examination steps you have to do in any orthopedic case. See, for any orthopedic case, there are 7 steps you have to follow. It is a little bit different from the examination that you do in surgery as well as in general medicine. Here, what are the 7 steps? First, you have inspection, then you have palpation, then you have percussion, then comes measurements, then you have movements of the adjacent joints of whichever limb you are inspecting. Then you have to do a neurovascular examination, and finally you can do some special tests. So these are the 7 steps. So which are the 7 steps? Inspection, palpation, percussion, movements, measurements, neurovascular examination, and special tests. So we'll go through each of these in order one by one. For any joint or for any limb, the basic constituents of examination would be the 7 steps that I have told you. Only the minor differences may be there. So for demonstration purpose, I am just demonstrating how to inspect an injury to the upper limb. Let's discuss the injury in and around the elbow. Just imagine that our friend here has a pathology, orthopedic pathology around his right elbow. So how can you go about inspecting, palpating and doing other steps in our examination? So obviously, as we know, the first step is obviously inspection. In inspection, the first thing you do is to look at the skin. You look at the skin and see if there are any abnormally dilated veins. See if there are any scars, sinuses, any other abnormalities, any swellings or as such on the skin. Once you have checked the skin, look for any swellings. The third thing you have to look for is to see if there are any deformities. So in the elbow, what are the 2 deformities you can see? Either there could be cubitus valgus or cubitus varus, isn't it? So check for any such deformities. Then look for muscle wasting. Most of the orthopedic disorders, you will have some amount of muscle wasting because of the disuse atrophy. If there is an abnormality in a particular joint or in a particular arm, the patient is not going to move that arm, and this is going to cause disuse atrophy of the muscles. So this will cause wasting of the muscles. So these are the things that you do in inspection. Once inspection is finished, the next step is to do palpation. And what is the first step in palpation? Remember, always the first step in palpation is to check for rise of temperature, local rise of temperature. Why is that the first step? Because once you start palpating for other things, your hand warmth and the friction at the area can cause an abnormal rise of temperature. That is not correct, isn't it? So first you check for any local rise of temperature. Once you do that, go for the next steps. Next step is what? Eliciting tenderness. So where do you elicit tenderness? Around the bony prominences. In the case of the elbow, it would be the lateral epicondyle, the medial epicondyle here. Then you have to check for the tenderness in the elbow and obviously in the radial head. You were checking the wrist, you can look for the tenderness around the radial styloid, the ulnar styloid, the anatomical snuff box, etc. If you are checking the lower limb around the knee, you have to palpate for tenderness around the medial and the lateral femoral condyle, and also the medial and lateral tibial condyle and the fibular head. So whichever joint or whichever area you are examining or palpating, you have to modify the points of palpation that you will do for eliciting tenderness. Once you have examined for tenderness, next thing you will do is to check for the surface of the bone. You palpate the surface of the bone to see if there is any abnormality there. Sometimes there will be irregularity on the surface of bone, and which condition produces that? Chronic osteomyelitis. See, chronic osteomyelitis is a case that is often kept for final year exam. So it is important that you don't miss this finding there. So in chronic osteomyelitis, there will be some surface abnormality when you palpate the bone. The next thing you will check for is abnormal mobility. What is abnormal mobility? A mobility at an area where there shouldn't be any mobility, isn't it? Abnormal mobility can be of two types. It can be painful or painless. Where do you get painful abnormal mobility? In an acute fracture. Okay, in an acute fracture it would be painful and there will be abnormal mobility. In the case of non-union, you will get abnormal mobility which is painless. Again, non-union is a very important case for your exam. So remember, if there is abnormal mobility at a particular site which is painless, it indicates what? It indicates non-union. And finally, you have to palpate for any swellings. You palpate for any bony swellings or any other kind of swellings in and around the joint or the limb that you are examining. So if there is a swelling, you have to follow all the steps that you have already studied in surgery, isn't it? The size, shape of the swelling, the consistency of the swelling, if there is tenderness or not, if it is mobile or not, what is the plane of the swelling, is it bony inconsistency, all these features you have to examine. The next step in examination in orthopedics is percussion. See, percussion is not widely useful in orthopedics. It is generally used for eliciting tenderness in deep-seated areas. For example, if you want to elicit tenderness in the vertebra or in the sacroiliac joint or in the ischial tuberosities, which are all very deep, it is very difficult to press with your finger and elicit tenderness. So what you can do is that you can ask the patient to stand on the floor like this, and if you are examining the spine, and if you want to examine for tenderness, you can start by pressing with your fingers and ask the patient if there is any tenderness. If there is no tenderness and you are suspecting something, you can gently tap on the spinous processes with your fist like this. It should be gentle, it should not be violent. Gently you can just percuss on the vertebra like this to see if there is any tenderness. Okay, so this is the importance of percussion in orthopedics. The next step in orthopedic examination is measurements. What are the two things that you will measure? You have to measure the linear dimensions, that is the length of the bone. Then the second thing, you will have to measure the circumference of the limb. So linear measurements and circumferential measurements has to be done, and therefore whenever you go to your exam, you should have a tape with you. You always carry a tape measure with you for measuring the various dimensions. Okay. Now, how can you measure the linear dimensions of a bone? It should always be measured from one bony point to another bony point. For example, if you are measuring the length of the humerus, obviously it is very difficult to look at the top of the or palpate the top of the humerus. So what you can do is that you can take two substitute points. You can start measuring from the angle of the acromion till the lateral epicondyle here. Okay. So what you can do is that you can take your tape measure and you start measuring from the lateral epicondyle till the angle of acromion like this, and you can compare it with the opposite side whether it is same or not. So always check whether there is lengthening or shortening or some other abnormalities like that. Once you do that, the next step is obviously to measure the circumferential diameter. Why do you need to measure the circumferential diameter? This is to check for wasting. You need to know whether there is wasting or not. How can you measure for wasting? So again, what you can do for measuring the wasting is that first you mark two same points on both limbs. So here I am marking the lateral epicondyle here. I am also marking the lateral epicondyle here. Now I take around 10 centimeters from the lateral epicondyle like this, and I mark a point here. I take 10 centimeters from here and mark a point here. And once I do that, I measure the circumference around the arm and I compare it with the opposite side to see if there is any increase or decrease in the circumferential width. So if there is any circumferential decrease in width, what does it indicate? It indicates that there is wasting in the limb. So remember, measure always the linear measurements and the circumferential measurements. So if you are measuring the forearm, the points that you can take are the lateral epicondyle or the radial head till the tip of the styloid process. If you are measuring the lower limb, usually you have to measure the leg. For that, you can use the lateral femoral condyle or the lateral tibial condyle till the lateral tip of the lateral malleolus. So you can use these kinds of points for measuring the linear length of various bones. Once you are done with the measurements, next step is movements. Always remember to check for the movements. If you are examining the elbow, you have to check for the flexion and the extension, and you have to compare it with the opposite side. If you are examining the shoulder, you have to obviously check for flexion, extension. Along with that, you have to check for the internal rotation, external rotation, the abduction, and also the adduction. Same with the hip joint, where you have to look for the flexion, extension, abduction, adduction, external and internal rotation. For the knee, you just have to check for flexion and extension. So whichever joint you are examining, check for the appropriate movements. Now, what if you are examining the arm? In case there is a swelling in the arm, is it necessary to look for the movements? Yes. If there is an abnormality in one of the limbs, then make sure that you examine the joint proximal and distal to it. For example, if there is a problem in the forearm, you have to look for the movements in the elbow and the wrist. If there is a problem in the thigh, you have to look for the movements in the hip joint and the knee joint. You got the gist? No. So whichever part you are examining, you have to look at the adjacent joints, one joint proximal and distal, to assess the movements. The next step you have to do is to check for neurovascular abnormality. So this is very, very important and is often missed. Remember, orthopedic examination is not complete without checking for neurovascular status. Very, very important. So neurovascular status means you have to check for the nerves as well as the vessels. Vessels, mainly your arterial supply, you have to check. How can you say test for arterial supply? Just look for the pulses, that is all. So if you are checking the upper limb, you have to mention regarding the brachial pulse, you have to mention regarding the radial pulse as well as the ulnar pulse. You just examine for all these pulses and compare it with the opposite side. Okay, you check if the pulse volume is same on both sides. If you are examining the lower limb, you have to check for the femoral pulse, the popliteal pulse, the tibialis anterior pulse, and also the dorsalis pedis pulse. I think all of you know this. And after your arterial examination, you have to look at the neural examination or nerve examination. In nerve examination, you have to look for the motor as well as the sensory examination. The thing is that you don't have to look for the entire CNS examination that you do for medicine and all. That is not required. You look for the appropriate thing. I'll give you an example. If you get a case with cubitus valgus deformity, there is a patient with cubitus valgus deformity like this. Just let's think that there is a patient with cubitus valgus deformity. And we know that cubitus valgus usually occurs because of a non-union of lateral condyle of humerus, and because of which there is a nerve that is susceptible for injury. What nerve is that? The nerve that goes like this, which is your ulnar nerve. There is a risk of tardy ulnar nerve palsy. So obviously you will have to check for ulnar nerve and its functions, isn't it? Let's take another instance. A patient comes to you with a supracondylar fracture. So what is the nerve injury that you suspect? You have to suspect median nerve injury. So you specifically examine for median nerve injury. Now let's take another example. A patient comes to you with a swelling, let's say an osteochondroma of the fibular head. So which nerve will you test for? There is a nerve that binds around the neck of the fibula. What is that? That is your common peroneal nerve, isn't it? So obviously you will have to examine for the common peroneal nerve function. Check if there is any foot drop. So all these things you have to check for appropriately. Don't go haphazardly and check for all nerves. That is not what is required. Check for the appropriate nerve function based on your case. Understood? Now, once you have finished all the first 6 steps, you can go in for some special test, which is not very important at your UG level, but I'll just tell it for completion's sake. What are the examples of some special tests? Let's say a patient, you are suspecting carpal tunnel syndrome. The test that you can do is what? Pallen's test. You know, no? where you ask the patient to keep the hand like this and check if there is any reproduction of the paresthesias. That is your Phalen's test. So if you are suspecting carpal tunnel syndrome, you do Phalen's test. If you are suspecting thoracic outlet syndrome, which test will you do? You have to do the Adson's test. If there is a problem in the hip joint, you can do the Thomas test and the Trendelenburg test. So depending upon the case scenario, you can do special tests. This is not very important. I am just telling you for completion's sake so that you get an idea of how the orthopedic examination is done in a whole. So to summarize, what are the 7 steps you have to do? First, you have to do inspection, then palpation, then percussion, then measurements, then movements, neurovascular status examination, and finally special tests. Thank you.